Suctioning the nasopharyngeal and oropharyngeal airways.
Good day everyone! This video is about the written demonstration of suctioning the nasopharyngeal and oropharyngeal airways. The goal for this procedure is to the patient exhibit improved breath sounds and a clear patent airway. So before performing this procedure, we need to verify the physician's order. So I have here Akira Nam. The medical record number is 54321-4321. The date of birth is September 3, 2001. She has no allergies and she has an order for nasopharyngeal suctioning. So the same goes when the physician orders oropharyngeal suctioning. So after verifying the physician's order, then we can now proceed to performing the procedure. Further ado, let's begin with the first procedure. So for our first procedure, bring necessary equipment to the bedside stand or over bed table.
Equipment include mask, sterile gloves, clean gloves, sterile suction package, water-soluble lubricant, towel or waterproof pads, pulse oximeter, and stethoscope.
To perform hand hygiene and put on PPE if indicated. So we have the PPE we have is the gloves, mask, and the goggles or face shield. So now we're gonna perform the hand hygiene. So after performing hand hygiene, put on PPE.
Next procedure is to identify the patient.
Good day, ma'am. I'm Malva Inacario, your student nurse for today. I'm here to do some suctioning, ma'am. Ma'am, ano pong pangalan natin?
Akira naman po, ma'am.
Okay, ma'am. Kailan po yung birthday niyo po?
October 9, 2001 po, ma'am.
Okay, ma'am. Verify ko lang. Tignan ko lang po yung identification bracelet, ma'am. Okay. Okay, thank you po.
Close curtains around bed and close the door to the room if possible. Determine the need for suctioning.
Ma'am, nahihirapan ka po bang huminga?
Medyo po.
Sige, ma'am. Check lang natin yung breathing mo, ma'am. Yung paghinga mo. Gamit itong stethoscope ko. Tapos may ilalagay po tayo dito para i-check yung ating oxygen at saka yung pulso, yung pulse rate mo. Okay po, habang hinihintay yun. Okay. Okay. Relax ka lang. Okay. Tingnan natin, 97, 71.
Verify the suction order in the patient's chart if necessary. For post-operative patient, administer pain medication before suctioning. Explain what you are going to do and the reason for suctioning to the patient even if the patient does not appear to be alert.
Po natin is maglalagay lang po ako ng catheter sa ilong. I-enter po or papasok doon sa ilong nyo. Tapos po, susubukan po natin tanggalin yung nakabara sa daluyan ng hangin para makahinga po kayo ng maayos. So, ayun po, yung pinaka-purpose ng ating procedure, ma'am.
Reassure the patient you will interrupt procedure if he or she
Ma'am, kapag
indicates
nahihirapan
respiratory
po kayong
difficulty.
huminga, wag po kayong mag-atubiling sabihin sa akin at para maitigil po natin yung procedure.
Adjust bed to comfortable working height, usually elbow height of the caregiver, lower side rail closest to you. If the patient is conscious, place him or her in a semi-Fowler's position. If patient is unconscious, place him or her in the lateral position facing you. Move the bedside table close to your work area and raise it to waist height. Place towel or waterproof pad across the patient's chest. Adjust suction to appropriate pressure. Since my patient is in adolescent stage, I will use 80 to 120 mmHg. Put on a disposable clean glove and include the end of the connecting tubing to check suction pressure. Place the connecting tubing in a convenient location. Open sterile suction package using a septic technique. The open wrapper or container becomes a sterile field to hold other supplies. Carefully remove the sterile container, touching only the outside surface. Set it up on the work surface and pour sterile saline into it. Place a small amount of water-soluble lubricant on the sterile field, taking care to avoid touching the sterile field with the lubricant package. Increase the patient's supplemental oxygen level or apply supplemental oxygen per facility policy or primary care provider order. Put on face shield or goggles and mask. Put on sterile gloves. The dominant hand will manipulate the catheter and must remain sterile. The non-dominant hand is considered clean rather than sterile and will control the suction valve on the catheter. With the dominant glove hand, pick up sterile catheter. Pick up the connecting tubing with the non-dominant hand and connect the tubing and suction catheter. Moisten the catheter by dipping it into the container of sterile saline. Occlude Y tube to check suction. Encourage the patient to take several deep
So,
breaths.
ma'am, inhale po tayo. Exhale. Inhale.
Apply lubricant to the first 2 to 3 inches of the catheter using the lubricant that was placed on the sterile field. Remove the oxygen delivery device if appropriate. Do not apply suction as the catheter is inserted. Hold the catheter between your thumb and forefinger. Next, insert the catheter. For the nasopharyngeal suctioning, gently insert catheter through the nares and along the floor of the nostril toward the trachea. Roll the catheter between your fingers to help advance it. Advance the catheter approximately 5 to 6 to reach the pharynx. Then, for oropharyngeal suctioning, insert catheter through the mouth along the side of the mouth towards the trachea. Advance the catheter 3 to 4 to reach the pharynx. Apply suction by intermittently occluding the Y port on the catheter with the thumb of your non-dominant hand and gently rotating catheter as it is being withdrawn. Do not suction for more than 10 to 15 seconds at a time. Replace the oxygen delivery device using your non-dominant hand if appropriate and have the patient take several deep breaths. Flush catheter with saline. Assess effectiveness of suctioning and repeat as needed and according to patient's tolerance. Wrap the suction catheter around your dominant hand between attempts. Allow at least a 30-second to 1-minute interval if additional suctioning is needed. No more than 3 suction passes should be made per suctioning episode. Alternate the nares unless contraindicated if repeated suctioning is required. Do not force the catheter through the nares. Encourage the patient to cough and deep breath between suctioning. Suction the oropharynx after suctioning the nasopharynx. When suctioning is completed, remove gloves from dominant hand over the coiled catheter, pulling them off inside out. Remove glove from non-dominant hand and dispose of glove, catheter, and container with solution in an appropriate receptacle. Assist patient to a comfortable position. Raise bed rail and place in the lowest position. Turn off suction.
Next is to
Remove
turn off the
supplemental
suction.
oxygen placed for suctioning if appropriate. Remove face shield or goggles and mask. Discard. The next is to perform hand hygiene.
Trio.
Offer oral hygiene after suctioning. Reassess patient's respiratory status, including respiratory rate, effort, oxygen saturation, and lung sound. Remove additional PPE if used. Perform hand hygiene.
Trio.
Document care and observation. Refer if necessary.